All right, so it's time to start the meeting. So a couple of things before I hand it over to President Ajay Bawala. As Siddharth said, keep the videos on, not only the photograph, but for the entire duration of the meeting. That's one. And the second thing, keep your phones in a silent mode if you're unmuted. And yeah, preferably keep yourself unmute unless you've been asked or talking or having a conversation with the speaker or any question and answers at the end. With that, I'll hand it over to President Ajay. Ajay, all yours.
Thank you, Amrish. Meeting call to order. Thank you, ladies and gentlemen, and welcome to our weekly meeting. And I'm glad to see all the wonderful audience here. It's an honor to welcome you all for this weekly meeting. Rotary Club of Bangalore Junction cares for all of its members, their families, friends, and communities around, and always look for experts and extraordinary speakers who can enlighten us, educate us, and inform us on various subjects. In the similar context, with us today, we have Rotarian Dr. Sunil Dwivedi, who will give us a brief on heart care, and would like to take this opportunity to extend a very, very warm and a special welcome to Rotarian Dr. Sunil Dwivedi. Thank you, Doctor, for accepting our request to address the audience in the hall today. We welcome you.
Thank you.
I now invite our club secretary, Rotarian Siddharth Hamirwasya, for the report.
Thank you, President. Good evening, Rotarians and ANETs, and most importantly, Rotractors who have joined today, as well as guests. It is my privilege to welcome you to this meeting. Let me quickly just walk you through the events we had in the past 1 week. Last Saturday, 5th of March, we celebrated our Charter Night. It was the 12th year celebrations, and Rotary Club of Bangalore Junction is just entering its teens now. A very good program, must say. Congratulations to the club service team and the organizers. On Sunday 6th, we conducted Raila at Government PU College in Sira and Government Polytechnic College, again, which is in Sira. And in both the places, it was done in parallel. In the first college, we had 158 students and the second one, 138. So approximately 300 students were attending the event. The event was conducted by Rotary Club of Bangalore Junction, and there was very, very active involvement from our Sira Satellite Club, as well as the district Raila team. So it was a wonderful event, and congratulations to Amrish and the youth service team for taking active lead in this, and to the Sira Club. On Monday, 7th March, we had a blood donation camp. This was with Janagar Voluntary Blood Bank under the chairmanship of Dr. B.D. Patel, who's on the call today, at Tegutech India Private Limited, in collaboration with Blazers Coating India. And both these companies put together had a very, very successful blood donation drive. We collected 84 units of blood. So congratulations and very good leadership, Dr. B.D. Patel. Moving on to the celebrations during the week. On 11th, that is today, Ann Renu Murarka celebrates her birthday. Happy birthday, ma'am. On 13th, Sunday, Rotarian Shiva Prasad in Goa will celebrate his birthday, and also Ann Shalini Dwivedi. And it will be the anniversary of Ann Rita and Rotarian Bipin Ram Agarwal. On 14th, Rotarian B.K. Krishnamurthy would celebrate his birthday. Wishing a very happy birthday and happy anniversary in advance. Most importantly, we have Holi coming up on 17th. So very happy Holi in advance to all Junctionites present on the call. And with this, I hand over back to President Ajay Bawala.
Thank you, Siddharth. And friends, I just run through a few very important announcements. I request you all to please make note of these and also share it with our other members in the club. So number one is that tomorrow we are hosting a training program for the incoming assistant governors, zonal governors, lieutenant governors, district officers at Hotel The Den in Whitefield. And this is going to be a great learning experience, and it is open to all the junctionites as well. Please do let us know if you would be interested to join in. It starts from 9:30 in the morning, and it's a full day event, and a few members are even staying back overnight for the following day's training program. And subsequently, I have another very, very important announcement. We are having a collaboration with our satellite club of Disha LNT to construct two classrooms and a dormitory at a government school in Shantinagar. The place is very badly in need of this facility, because there are children who are literally sitting and sleeping in the open, and because the shed which is there, it's made of temporary sheets which is already broken, and they were giving their exams also sitting on the floor without any facility. So I'm glad that we are able to take up this project with our satellite club. And then we have our awards night celebration that is scheduled for the 9th of April, which happens to be a Saturday. It's going to be a family dinner. And now one very important activity is that we are conducting a walkathon on Sunday, the 27th of March, to promote the Human Milk Bank project that we have in collaboration with Gunashila Hospitals in Baswangudi. The details will be followed very soon. And I request all of you to please attend with your family, friends, and near and dear ones, and make this walkathon and the project a grand success. May I now invite our Director, Youth Service, Rotarian Amrish Kothari, for a short, quick update on the event that we've scheduled for tomorrow.
It's on Sunday, Ajay.
Yeah, I'm sorry, it's on Sunday.
Yeah, no worries. So, so on Sunday, as Siddharth just gave you too many things happening. So Sunday, we have a sports meet for the rural youth. That's in partnership with Satellite Club in Sira. And this is for the 400 students of government high school. It's 400 students. It's a big event. So the stadium has been booked, the Shri Vivekananda Stadium in Sira. It will be a jam-packed, hopefully, with all COVID protocols in place, and more than 20 events are planned for that particular day. Athletics, 100 meter, 200 meter, shot put, discus throw. You have group games like throw ball, kabaddi for boys and girls, and shuttle, badminton, plus a lot of other games like football and everything. So quite a lot of arrangements have been done along with Sira, and this is one of the biggest event actually in the Avenue of Youth Service. And as Ajay said, it's not only in the club, in the district as well, because at such large scale sports meet generally people do not organize. So this we're trying to do it first time as well from our club as well. So I request all the members to join us. We look forward to see you there and witness one of its kind event basically, and motivate all the participants. We'll be carpooling, right? So that we will have great time together on the travel as well. So if any one of you are interested, definitely looking for all of you to join. Please do let me know or Ajay know. We'll figure out a way to pick and drop, and how many cars and the overall logistics for the program on Sunday. The program starts at morning 8 o'clock. We don't want to go a little bit late in the afternoon. The program, so we're starting a bit early, so that since it's very summers have started pretty much in Sira. I mean, so last time we went around 37 degrees already. So do not want to extend the program later than afternoon. So start early, finish early, and come back early.
Thank you, Amrish. Thank you, Amrish. Really appreciate your efforts and passion. And friends, I should acknowledge the contributions and support, unconditional support being extended by our past president, Rotarian B.K. Krishnamurthy sir, who has been a very, very strong pillar of support in connecting the two, Satellite Club of Sira and Rotary Club of Bangalore Junction, and giving us this opportunity of meeting such wonderful children, wonderful students over there who are so curious, so eager, so enthusiastic, so energetic, energetic that it's a great feeling. BK sir, would you like to add a few sentences here?
Thank you. It is Amrish who has really put in effort. I am only just guided him. That's it. The credit goes to Amrish.
Your simplicity and humbleness is way apart, BK sir. But nevertheless, thank you so much for supporting us and helping us in this. May I now invite our Joint Secretary, Rotarian Jitendra Shetty, to introduce the guest speaker of the day, Rotarian Dr. Sunil Dwivedi.
Yeah, thank you, Mr. President, for this opportunity. A very good evening, fellow Rotarians, ladies and gentlemen. It gives me great pleasure and it is indeed an honor to introduce our chief guest for this evening, Dr. Sunil Dwivedi. Here is a brief overview of his notable achievements. In terms of his qualification, he is MD, DM Cardiology from AIMS, New Delhi, FSCAI from United States of America. For the last 2 decades, he has been associated with the most reputed hospitals in the country. To name a few, those are Vikram Hospital, Fortis Hospital, Walcott Hospital, and he has also been as the observership in Texas Heart Institute, which is located in the United States of America. In terms of his special interest, he has interest in pacemakers, heart failure devices, complex coronary interventions, including rehabilitations. In terms of research and experience, he has vast research. He has a vast experience of various national and international studies. He is currently the senior consultant cardiologist at Manipal Hospital at Millers Road. Friends, nowadays we very often hear about we losing our friends and families because of heart attack. Last week itself, I lost one of my friend who was my classmate, and it was due to heart attack. And today, it is indeed a pleasure to have with us our chief guest, Dr. Sunil Dwivedi, who, with his vast experience, is going to throw some light on how to keep our heart healthy. So, ladies and gentlemen, without any further ado, please help me welcome Dr. Sunil Dwivedi to speak on how to keep our heart healthy. Over to you, Dr. Sunil Dwivedi. The screen is all yours. Thank you.
Thank you very much. I'll just share my screen first. One second. I'll just start my lecture. Can you see the slides?
Yes.
Yeah.
Yes, doctor.
Yeah. Thank you very much, President and all fellow Rotarians, for giving me this opportunity to speak about this topic. This topic is, spoken well often in so many fora, and recently also a lot of people have spoken and written about it. So why I'm taking this topic again? Because I just want to put some different perspective or different points which are not well spoken of most of the times. This lecture I've used in so many forums, so some of you may be familiar with it, but I'll be focusing on only very few points which are in the mind of a lot of general public. That we have seen a lot of people having heart disease recently and dying, especially young and those who are fit, celebrities also. So the questions in the mind of general public is, why it's happening so much to our population, why it's happening to young people, why it's happening to people who are seemingly very fit, and is it worth doing all those activity, fitness and diet or not? And is there any other thing which we can use to predict it more accurately, and what is the reason for it? So I'll just go through a few basics and the focus on these points. Quickly, I'll finish it and I'll be open to some question answers. So the topic is healthy heart, as you know. The aim is to have a heart healthy or a body healthy. So a lot of people think about cardiac arrest and heart attack. Heart attack is different, cardiac arrest is different. Cardiac arrest means heart stops because of whatever reason, and heart attack is loss of supply to the heart, which can lead to cardiac arrest. So these are the things to not to confuse with that. Why heart attack or unhealthy heart is dangerous, apart from causing symptoms and disability of not able to work properly? Sudden cardiac death is one of the worst manifestation, where the heart can cause attack and then the rhythm disturbances and stop, or even if there's no heart attack, weak heart or a lot of structural heart disease which are undiagnosed can cause rhythm disturbance and sudden death. So sudden cardiac death is one of the most dangerous, unexpected and devastating complication of any heart disease. So we should strive to avoid it to the maximum possible, apart from giving symptom relief to the patient. There are so many reasons for the issues about heart attack, heart death or cardiac arrest. But let's focus on the common thing, which is the loss of blood supply to the heart, which we call as commonly atherosclerosis and coronary artery disease that leads to heart attack. So number of cardiovascular diseases in India projected to surpass any other country in the world by 2020. This was a projection by WHO earlier. We have already done that. So we are not only diabetic capital of the world, but we are heart disease capital of the world. And what is coronary artery disease? The heart attack which causes. So left side, there is a normal supply, a tube which is known as artery. If you open the inner lining is reddish, it means healthy. When there is a fat deposition, which we call as cholesterol, then becomes yellowish seeing type, and then it increases in severity and can cause obstruction to the supply. And now in India, the coronary artery disease or the normal heart disease, what we call, is the leading cause of cardiac arrest from 25 to 30 years of age group onwards. So, and this is increasing in the younger population. The average patient with the coronary artery disease is 52 years in India, which is plus 60 plus in Western countries. And among diabetics, every third patient has coronary artery disease, every 10th patient has heart failure. So since we have a lot of diabetic patients, so 30% will have this heart disease. So if you combine with this statistics into our population, the number is huge, and any younger population, which is less than 55 years of age. So now if I focus on heart disease or heart attacks in young, there was no clear definition. Traditionally, we took it as less than 55, but in India, rising incidence is under 45 years of age, especially less than 35 years of age. And as a genetic marker, means, race, we are more prone to having heart disease as compared to Chinese or Americans or Japanese. And there can be so many reasons for this heart attack. I will not go into detail. So whenever you have a disease or a pathology, there are some risk factors involved in that. If you check the risk factors, you can reduce the disease. So what are the traditional risk factors for heart disease? So a lot of studies have been done, then how much it increased. So the studies in South Asian countries was very minimal. So now this one Interheart study showed that smoking is very significant, tobacco in any form, especially smoking, hypertension, diabetes, abnormal cholesterol ratio, abdominal obesity means the fat we found around the tummy, absence of physical activities, psychosocial issues. These are the common causes for the heart disease. And if you combine them, the effect is very, very additive. What are the non-traditional cardiovascular risk factors, which are not found in a common public all the time? One is family history of premature heart disease. That's a genetic variation where you don't find one single gene, but even the normal cholesterol becomes like a poison. And then you see people who are not diabetic, don't smoke, vegetarian, a lot of will have in 30s or 40s heart disease in family. That's a genetic variation found in our population. There is a specific cholesterol which is known as lipoprotein A, that if it is high, it can make even normal cholesterol very sticky. So if you find normal cholesterol, no other risk factor apart, you can do lipoprotein A. Homocysteine level increases the clotting factor. Now, oral contraceptive pills, indiscriminate use also in middle-aged female can cause heart trouble. And there are different types of cholesterol pattern which are related to unhealthy lifestyle, which is like high triglyceride, high dense LDL, low HDL levels. Now, let me come to the important thing, that metabolic syndrome. If you see in India, most of the people look okay, not overweight much. Not the eating habits and other things are very okay. You don't find them doing any indulgence and all, but still they get heart disease or they get diabetes early. So you will see very diminutive figure having diabetes, not doing much. This is mainly related to metabolic syndrome. And metabolic syndrome. What is metabolic syndrome? What happens in the body, usually with less activity and more of a calorie intake, slowly body goes into a situation where you start developing fat around the tummy. Small, the figure is okay, but the paunch is there. It leads to a lot of metabolic abnormality and insulin resistance, because that fat is very, very damaging and active. It doesn't allow the sugar to burn easily. It resists the burning of the fat even at normal good activity. So it causes cholesterol abnormality, which are mild, but they are dangerous. It causes hypertension. And this is not a full-fledged situation of developing a diabetes or heart disease, but in next 5 years, such people developing risk of diabetes, stroke, and heart attack is 2 to 4 times in next 5 years. And this is prevalent in 35% of India. And the cause is urbanization, industrialization, increased calorie, decreased mobility. So as we are shifting from a less active lifestyle in our daily activity, like used to go and cycle, walking, doing farming, other manual labor, we are coming out of it, and the people are shifting to urban areas, industrialization work, and the cheap calories, fast foods or even the street food, which is high in calorie, it is less cost is available. Then it combined with less mobility, you have calorie excess in the body and gets deposited around the waist, and it leads to metabolic syndrome. It lead to all these things. So that's why we see that people who they don't look unhealthy by their weight or by their activity, but they are harboring this metabolic syndrome, which is not paid attention to most of the time in preventive healthcare. So these are the traditional risk factors. We know diabetes, hypertension, and also metabolic syndrome lead to many of these things. So the key is to avoid worry, worry, and curry. I'll just go to each of these things. The smoking is 1/3 of the cardiovascular death attributed to smoking. Active or passive smoking are equally dangerous. Smoke like tobacco is as harmful as cigarette, and smoking reduction is almost no benefit. Means somebody says, I've reduced smoking. No, it's not going to work. Smoking is absolutely yes or no. There is either you are a smoker or not smoker. Then when smoking, in the peer pressure, you should be direct, change the subject, walk away, avoid the situation. These are the things to reduce the smoking habits, or reduce, avoid picking up the smoking habit. Physical activity, hypertension, lack of physical activity, diabetes, very much involved in the heart disease. I'll just go first for the healthy diet and healthy diet, and then go for the activity and up this thing. So now what you see that the metabolic syndrome a person is having, and these people think that they eat well and they don't eat wrong, but how we slowly go wrong, we'll see by this. So more fruits and vegetables people should eat, not in the middle age or old age, but they should start from the early age. Mostly non-polished grains should be eaten. If non-vegetarians, fish's intake is thrice a week is good, and limit the intake of saturated fat. The fats which are solid at the room temperature are saturated fat. They should be taken, but they should be less in quantity. No trans fat. Red meat should be limited. That's what is very important. Now, a lot of us have aerated drinks, like they are very heavily coated with sugars. And if you take once or twice a week also, it gives a lot of calorie, which is very, very empty calorie. And you see that trans fatty acids are more dangerous. Trans fatty acids are produced by deep frying, especially if you have, pizzas, burgers, French fries, samosas, matris, kachoris, processed food, especially if the oil is used again and again. These trans fatty acids are produced by partial hydrogenation, and even at less level, they make the normal cholesterol very sticky and cause the cholesterol blocks. So before that, I'll go to the health activity, then I'll come back on the summary. So how much physical activity we should do? So average 19 to 64 years of age, there's 150 minutes of moderate intensity activity you should do. If you cannot do in half an hour of activity, you should do at least 10 minutes, or you can bouts of 10 minutes you can do. People who say they cannot do in one time 30 minutes, then you can do 10 minutes. Or if you do a vigorous activity, then 75 minutes of vigorous activity per week is good enough. All of us should do weight training minimum 2 days a week. It doesn't mean weight lifting. You do muscular exercise, isometric exercises, and keep on walking as maximum as possible. The moderate and vigorous physical activities are bike riding, swimming, brisk walking is good enough, tennis, gardening, jogging, soccer, aerobic, dancing, jumping rope. There are so many activities you can go on online and see in Google. Now, I'm just going to summarize few things. The most important thing about us facing all these problems is, one, our population is huge. Second, we have more of a younger population. And with over a period of time, we have a genetic predisposition where no single gene is responsible. It is a polygenic. So in olden times in this peninsula, we had a lot of famine and pestilence. So during the time of good food availability, bodies have used to, accumulating calories around the tummy, and so at the time of famine, when the food is not there, they can utilize it. Over a period of time, when the famine has disappeared virtually, this genetic predisposition is leading to deposition of fat around tummy with very little excess calorie intake and less physical activity, which is being promoted by industrialization, urbanization, as I spoke, and cheap calories, empty calories available. This leads to metabolic syndrome, which quickly leads to the higher heart disease or stroke and diabetes. Now, if you combine it with few things, what are those few things which are very negative? We don't have any culture of regular preventive health checkup, which should start with 18 years onwards. In Western society, there are a lot of structured preventive healthcare checks which are linked to your insurance, health insurance. So if you don't do it at particular age or few things, your insurance either will be costly or will not be renewed. So they are constantly monitoring their population for any mild deviation and giving advices, structured advices. We are lacking that. So most of the time in our population, after 11th, 12th standard, people going to college, more of a study, less of a sports and physical activity. When they come out in the job pressure, odd hour eating, junk food more. And then we come to middle age or early 30s, then suddenly people start doing exercises, or in 40s when they think I need to lose weight. By that time, you already develop many of them. Either they are silent diabetics, not knowing, silent hypertensive, because these are silent killers. And then they already deposited some cholesterol in their body, the heart or brain supply. That time, if you start doing unaccustomed exercises and diet suddenly, these times stress on these cholesterol blocks can cause sudden rupture and cause heart attack. And especially, so you have seen a lot of people have died while doing exercise or after that. Because during exercise, there is a lot of sympathetic stimulation, like, you have flight and fight hormones, adrenaline comes. It causes stress on the heart, increases the demand, and there is a little bit of blood dehydration. That's why hydration is advised during that. So the blood becomes sticky and the cholesterol can rupture. Sudden clot formation, and heart doesn't tolerate rhythm disturbances, sudden death. That's why you'll see a lot of celebrities dying like this. The other thing is that no proper rest. Any exercise, physical activity, dieting should be combined with rest. Very high level of activity, working and taking pride that I sleep 6 hours and 4 hours. If it's natural, fine. If not, the lack of rest combined with heavy exercises is a very, very deathly combination. So this is where we are lacking in our treatment or prevention of heart disease here. And that's why we have high death rate, high visible death rate we see, because we are seeing all these celebrities and other people who are doing it. There are a lot of people dying otherwise also. So more predisposition, genetic, poor lifestyle, which is really a poor lifestyle in terms of diet and exercise, very poor awareness about preventive health checks. Most of the preventive health checks are done by going as a, doing a blood test in a pathology lab where the rates are less, and nobody has paid attention, or some doctor has seen who's not competent enough to comment or guide you on that. And then people say, I've done 2-3 years of continuously health check, everything I've done, and it was all fine. When you get those records and see, there are warning signs. So we are lacking in those terms. And now it comes to that, what we can do. There is no single test or no single way to deal with that. A lot of things have come about. Shall we do regular ECG echo? Shall we do a treadmill or stress test? Shall all of us do CT coronary angiogram, CT scan angiogram? No, it's not like that. Most important thing is preventive health checks, talking to your physician properly, taking second opinion, and doing all relevant tests. There will be overdiagnosis or underdiagnosis in some cases, but as a population base, if you use this, we can filter out a lot of cases and counseling is needed. Most important thing in my opinion is that we should promote healthy lifestyle right from the school time, and that we should pay special attention during the high school and college days, and when the people join work early. If we put a structured preventive health program, not only for the heart disease in general, the healthy habits we inculcate, the knowledge and the insight we inculcate in our population will go in a very long way in reducing this trouble. So that's all. I finished my talk and I'm open to any questions. Thank you very much.
Thank you so much, Doctor. Really appreciate. And friends, now the room is open for some questions, specific questions, if anybody would like to come across with.
Yeah, Dr. Vijay Saraf here.
Hey.
Nowadays, people are very used to hookahs. So hookah, is it equivalent to smoking or is it mild, or what about your opinion about hookah?
Anything having tobacco is dangerous, whether hookah, cigar, cigarette, that's all.
Okay.
See, apart from chronic smoking, chronic damage, even the acute smoking, the one or two sessions of smoking can also cause problem. People who come to me and the BP is high, and I immediately know many of them who are smoker. I ask them, did you smoke in last 1 hour? They say, yeah, BP is high, heart rate is high. It causes tremendous stress. That can still lead to trouble.
Okay. Thank you, Doctor.
Yes, Shraddha.
Good evening, Doctor. I wanted to know, in case there is someone who has had a situation of hole in the heart in the early childhood and they have been operated successfully, is there any extra precaution to be taken by them, and they don't have any problem now as such?
No, most of the time you don't need it. Regular checkup and once in a year echo and ECG you just need. If the hole in the heart is very well controlled, means corrected, it should not bother. There are different situations. What was the original disease like? It was a cyanotic, means blue baby hole in the heart, or without blue baby hole in the heart. Because when you go for dental or any other procedure for any infection in the body, any small procedure, do you need extra dose of antibiotic to prevent infection in the heart? That depends on that. So otherwise, there is no major issue if the surgical correction is done, which is totally corrective.
Shraddha, I hope you've got your answer. We can.
Yeah. Thank you so much, Doctor. Thank you.
Shankalaji, yes.
Yeah, Dr. Saab, I just wanted to know whether is it true that the ladies has less number of heart attack than male? Female has less number of heart attack than male, and what is the reason for that if it's true?
It's partly true that, till the periods are there, till the menopause is not there, estrogen protects to a large extent from the heart disease, but it is not protective in few situations, like if patient develops diabetes or any conventional risk factors or family history is there. So there the protection is not there. But in general, if these major risk factors are not there, they have got less heart trouble. I'm talking of heart attack because of cholesterol deposition till 45, 50. But after the menopause, that protection is gone. So, but now we are seeing a lot of them are coming in the early 40s because of the lifestyle and the diabetes and so many other things. Some of them smoke, so that also changes the situation.
Got it. Thank you.
Thank you, Doctor. Any other question that is coming in?
Yeah, I have a question. How much is yoga breathing exercise going to help?
No, breathing exercise in particular, without any, they won't have any direct effect on the heart disease. Breathing exercise are good enough for the meditation, calming you, and then, some physical activity. So they are more of you control your mind along with your breath. That also helps because it reduces stress. So, because, a lot of people, these events, the disease remains in the body, pathology, the events are acute heart trouble are precipitated by stress, which is either a physical stress or mental stress. Physical stress means either you have smoked or you have run or done an exercise. Mental stress, you're under tremendous stress. Many patients we see, like, a life partner died and within 1 month they come with heart attack. This is very, 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 very established pattern. We see regularly in that because emotional stress is so much. The negative hormones, I'm just using this term for the general public, the stress hormones release can cause a rupture of the cholesterol block and then cause attack in that. So that's why when you do any activity which calms the mind, breathing exercise are one of them, very fantastic one, that helps in that way.
Can I come in?
Abhayji has raised his hand.
Doctor, I just wanted to know, for a senior citizen, you said the weight, not the weightlifting, but weight exercises are useful.
Yeah.
What sort of things you recommend for them?
No, the simplest one is that, dumbbells, 3-4 kg dumbbells, which you can do all the joint exercise, biceps, triceps, shoulder. So you do one set of exercise of one set of muscle, then give 24 hours to 48 hours rest and do 3 days a week. You can rotate your all the joint exercises. So simple dumbbells for the upper limb, you can upper body, then you can do simple squats. And means I'm talking of where you can do at home. In the gym, you can do for 4-5 kg is more than enough for old age to maintain the tone of the muscle. And what happens, aerobic exercise like walking, jogging and all we do, but unless we make our muscles healthy and stronger, you will have a lot of injuries because joints depend, integrity also depends upon the strength of the muscle. Second is muscles are very good consumer of sugar. So in diabetics, if you do only aerobic activity but don't tone your muscles, your sugars are not going to get control. But the moment you do muscle toning activity, isometric, sugars will start dropping better.
Shani is still complaining of stomach pain.
Okay. Thank you. Thank you, doctor.
Can I come in?
Yes, madam. Meeraji, please come in.
Good evening, doctor.
Good evening.
After taking all the precautions, if your cholesterol is on the borderline, how to take control, how to take precaution to take that cholesterol under control?
See, it
What
depends upon,
precautions should
yeah,
we
it
take?
depends upon what is the meaning of control. It depends upon each different individual. The control is very strict with the persons who already got disease, heart disease or stroke or blocks, cholesterol blocks in any part of the body, or the patient is diabetic or having multiple risk factors. There are strictly defined criteria. They are very, very strict, and only with diet and exercise you cannot do. You need to have medicine. Then there is a lot of population which are either in the medium risk or in the low risk. This question arises in this population only, whether you need diet and exercise only or you need medicine. The decision is to a major extent individualized. The reason, because there is no course of medicine for cholesterol reduction. Like, you take course of iron therapy, you take course of steroid therapy, but it's not. Cholesterol medicine is day in, day out, lifelong. So are you going to get benefit over a 5 years or 10 years with that medicine, or you are going to get more harm? So this is a case by case basis where you apply a population based statistics formula and then take your clinical assessment, discuss with the patient, and then follow it regularly. That's why it all depends upon what do you mean by borderline cholesterol. It depends upon your underlying situation. So diet and exercise and medicine, these are only things.
Okay, thank you so much.
Welcome.
Can I come in?
Yes, Dr. Srinath.
Hi, Dr. Dwivedi. Excellent presentation. I'm Dr. Srinath. I'm a pediatrician. Over the last 2 years, we have been seeing a lot of young people actually dying of heart attacks. And could it be related to the COVID pandemic per se? Sometimes asymptomatic COVID infections or maybe past-COVID infections. Also, is there any risk of COVID vaccinations increasing the heart attacks also?
So sure. So the thing is that COVID and vaccine have worked in many predictable and unpredictable ways of causing heart disease. First of all, COVID is a viral respiratory infection. So it's well known that any viral respiratory infection, including flu, can cause stress on the body and precipitate heart failure and heart attack. It's well known. That's why we are giving flu vaccine regularly to susceptible population. In northern hemisphere, the death rate from the normal flu in elderly 75 or 65 years of age is pretty high. So the COVID is one form of flu which will cause any stress in any patient who is predisposed to heart trouble and can bring the patient with a heart trouble, heart attack, heart failure, like that. Now, on top of that, COVID and these first two variants have shown very high when they've shown peculiarity, like a virus is finding its feet in the body and it doesn't know what damage it can do. We are also struggling. So increased coagulability or increased clotting pattern was a hallmark of first two variants, first one and Delta. So we have seen a lot of heart attacks or high clotting rate coming. And in second Delta, I mean, I've done enough angioplasties in COVID patients. Probably, never stopped doing it. But in the second wave, the poor response I've seen, even after angioplasty, stent getting clotted, the other event happening regularly, people dying, was much, much higher in even a small center experience. So it affected the coagulation system, clotting system, and caused problem. Not much with the last one, Omicron. Okay. Then you asked the COVID vaccine. COVID vaccine has caused, different vaccine have caused two different pathology. One is directly affecting the muscle and the covering of the heart, which will cause inflammation, where the supplies are not affected, but the heart gets inflamed and chest pain and heart muscle weakness causing heart failure, rhythm disturbances. And the other, that is with the mainly Pfizer vaccine. The other one is that it can induce very abnormal clotting in very rarely, very middle-aged females more, where the not only heart, but the lot of structures, brain and the stomach and all leg supplies can get clotted. It's like an immunological reaction. I have not seen till now that clotting reaction till now, because people could have died also, not come to us. I have not seen a pure muscle damage by the vaccine, but probably a lot of subclinical cases we have seen, which we cannot prove, where they develop fast heart rate after COVID or after the vaccination for prolonged period of time, few months. That's the most minimal subclinical form of heart getting affected by either vaccine or the COVID. But that's a clinical judgment. It's not proven clearly.
Okay, now Omicron, we know that it has got very, the mortality and morbidity are very less. And do you still recommend precautionary dose or what is booster dose?
I think I was pretty clear right from the beginning. Like, we are getting a flu shot every year. Like, I get it regularly because we are healthcare workers. So my flu episodes have come down significantly last 10 years. Probably I have not taken any single leave because of flu. In flu vaccine, if you see, we had a lot of SARS, MERS variants have come. Where SARS, it came, people forget because of the COVID that SARS was something, and then MERS, Middle Eastern respiratory virus, which high mortality rate, where people will go to Hajj and all or travel from Middle East will pick up that flu virus and come and die with ARDS going on ECMO devices. So in simple flu shots, the SARS and MERS antigen were incorporated, and then you get a one-stop shop, where one-stop shot where you can get immunity against all these variants. And it is annual affair. You have to take annually because the virus keeps on changing. So same thing will happen with COVID, where it will be an annual affair. Most likely, this is my thinking, because this virus is going to stay, keep on changing for survival. It may not become as lethal as was earlier, because virus has to make its host survive so that virus can also survive. The most deadly viruses are less contagious. If you see, the most contagious are less deadlier. So it will come to some equilibrium between humans and virus, and maybe in near future, in 2-3 years, most likely this COVID vaccine antigen will also be incorporated on a normal flu shot, and we'll have one shot which will take care of everything. This is what I can see.
So thrombotic episodes are not related to the vaccination as such?
No, it is related to some vaccine, but it's very rare. And now we are not seeing any reports even in Western literature right now.
And last question, when we have to do the general screening, is blood test along with the ECG and treadmill is good enough, for CT angio is required for people with high risk, for example, diabetes and hypertension?
No, first of all, good clinical history is very important. Second is, which will get a lot of risk factors. Patient looking very fine, everything is there, but you have strong family history, father, uncle, everybody before 50 years of age, heart disease. So if his blood parameters, TMT, everything is coming is normal, but this is a very, very strong risk factor that this person will also have before 55 heart disease. There you can choose to do a CT coronary angiogram to see whether there are minor blocks or not. It means the disease has started. So even if the normal blood levels of parameter and normal treadmill and normal ECG echo, you are going to start the medicine for this patient and along with the healthy lifestyle. But so clinical examination history, blood test for normal risk factors, ECG echo and treadmill wherever needed, not all cases. CT scan and judicious use in selected cases without hesitation should be done.
Thank you so much.
Welcome.
Thank you, doctor. Any more questions? Yes, Divya?
Doctor, there is many broad dead cases. By the time we reach it, when there is a cardiac arrest in the house, by the time we take them to the hospital, and by the time they get the electrocution, whatever the test, whatever needs to be done, or even the CPR treatment, whatever, I think that's the biggest risk right now. Is there anything that we can do at home? Like
No.
I see my grandmother taking some aspirin as per prescription, of course.
You can't do anything.
Is there something the doctors are planning as such for this? Because the
No,
mortality...
this is what you're describing is sudden cardiac death. Nobody can do anything. The only thing is if you are around some place where there's a defibrillator, so you put and give a shock and then make the person survive. Without that, if you do CPR, people who are not trained, it's not going to work. Training a large population for CPR is next to impossible. So situation what you describe is just even in hospital, if patient is down there in the lobby and then they fall dead, and then if you don't bring the things to him quickly, many of them don't survive. It takes 4.5 minutes for the brain to get dead. So what situation you describe, next to impossible to save. Preventive methods what I spoke are the same. It's not going to be different. That's what.
Thank you.
Thank you, doctor. So, doctor, is there any emergency kit which you can recommend that, okay, keep an emergency kit either in your workplace or in your home place, which could probably be handy? Is there something that you can suggest?
The only emergency thing which I'll advise is keep a Disprin, simple Disprin, not anything else, which can dissolve in the water. So that's the only thing a layperson or even a GP can do. Just chew it, keep it under the tongue for a minute and then swallow it with water. If the patient or whoever you are dealing is in a position to chew and swallow it, if they are not fully conscious, don't try to do that. Nothing else works. Nothing else should be done and time should be wasted. And if there is a suspicion of trouble, I'm using a word trouble because, it can be so many things. When patient is having heart trouble or any stroke trouble, or if a person is feeling okay, like say I'm having sweating, some acidity and all, many of them go to a diagnostic center and get ECG done. And they say doctor will read in the afternoon or evening. That should never be done. Always go to a nearby hospital, emergency care, and then get the things done. And then if you think something is wrong, get it transferred in ambulance to the bigger hospital where treatment can be done. The commonest mistakes are one, going to a diagnostic center in emergency, getting things done, going to a small clinic where the facilities are not there, and then you cannot manage by the time waiting for ambulance, basic resuscitation is not there. So if you feel you are sick and you need to have early, quick access to healthcare, go to a proper hospital emergency rather than going to any other places. Nothing else will work. I have seen enough.
Thank you, doctor. And what is the recommendation for health checkups, doctor? On what frequency? Maybe annually one health checkup?
Usually it depends upon the age. We don't have recommendation. At least once in 2 years after 30 people should do. That's what it is. Until, if they are all normal. If there are abnormalities, then doctor will tell you to repeat these things more frequently like that. But I think once in 2 years and after 50, once in a year, this is my impression. There are no structured recommendations.
Okay, and basically those confusion between probably a heart-related ailment or gas, because normally in our culture, what we've seen is we try to ignore कि नहीं gas का problem है, नहीं gas का problem है. I mean,
the moment my simple recommendation to the people is there are two things. The moment you feel that your discomfort is not the usual discomfort, okay, people who are having gas, belching, burping, having hot food and all, that's a constant pattern they will know, and it is happening over a period of time. So the acidity will never kill and gas will never kill like that. So they will survive and this will keep on repeating. But the moment they feel that this is something different or it's not going in usual time period, so unusual discomfort lasting unusual period of time, and making you think that this is this problem, my previous or this will go. Usually, if you get any acidity gas normal which is going off and all, you will not start bothering about it. Ki, ye to wo hai, wo to wo hai. You will not bother. Moment it leads to that thing that it's different feeling, leads to botheration that it's not going and might go, it may be gas. That's the time you should act. I will not define symptoms, burning, burping and all, because it confuses. Each one has got different.
Thank you, Doctor. I think we have covered with all the questions, and if can we are we good to close for the meeting now, or any more questions in the hall? Okay, so wonderful, Doctor. Thank you so much. Really appreciate the investment of time and knowledge that you have given to us. And for the benefit of all the members here in the hall, I take this opportunity in informing that we have been coordinating, like I said earlier, that we are the Rotary Club of Bangalore Junction. We care for the health of our members and their families. Past President Rotarian Santoshi Kejriwal, past President Rotarian Vijayji Saraf, Miraji, we had been having a couple of meetings with the management at Manipal hospitals. And after a series of meetings and discussing with other hospitals and other clinics also, we had collected some packages, health checkup packages from Narayan Hridayalaya hospitals, Manipal hospitals, and a few these clinics or laboratories also. I'm very, very happy to inform that Manipal Hospitals has given exclusive health checkup package for our club members and their families. And I will be sharing the details. It is a very comprehensive health checkup package, and it is a different package for the ladies and a different package for the gentlemen, which all of our members and their families can make use of, given the current dynamics of the health scenario that we are all going through. It is highly recommended that we have our health checkups done on a kind of regular basis. And so I'll share the details of this health checkup package on the groups. Please feel free to reach out. There is absolutely no obligation. There is no compulsion. It's an individual choice. However, for the benefit of our members, we have collected a package from Manipal hospitals, and this covers head-to-toe testings with free consultations with experts in those particular fields. Once the reports have been come, depending on the gray areas of the reports, the free consultation for the doctors will be done. This testing is a fasting test, and we have a free breakfast also arranged, and during the breakfast time, while we are waiting for that an hour or so, we can consult the doctors also and have a discussion on this. So this is an exclusive package only for our members. Yes, doctor, you're coming in.
Sorry, Ajay, can I leave? I have to just...
oh, yes, doctor. Thank you so much. Really appreciate. I understand you had told me that you have some professional commitment at the hospital, but I'm glad. Thank you so much, doctor.
Thanks. Thank you.
Can we have a round of applause for Dr. please?
Thank you very much.
Thank you.
Good night.
Good night. So members, I'll share the details on the group, and please feel free to reach out to any of our members to fix up an appointment for if needed anywhere. Thank you so much. And now may I invite Shraddha Agarwal to deliver the vote of thanks.
Thank you, President Ajay. A very good evening to all Rotarians. And I would like to express my heartfelt gratitude on behalf of the entire Rotary Bangalore Junction to Dr. Sunil Dwivedi, though he's left, but thank you so much. And thank you, President, and the entire club service team for organizing this session with Doctor. Thank you once again. Good night, everyone.
Thank you, Shraddha. And meeting adjourned. May I request everybody to please raise for the national anthem. May I invite Rotarian Divyashri to lead us through the national anthem.
Yes. जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कलवंगा विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा तव शुभ नामे जागे तव शुभाशिष मागे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
जय हिंद जय
Thank you, Divya. We're so happy. Thank you so much. And friends, the hall is now open for if we can, if anybody wants to suggest something, convey something, ask something. It is an open session now. Please feel free to unmute yourself and we can discuss.
Ajay ji?
Yes, sir. Please come in.
Ajay ji, I see you were talking about some what you call peace program for next Saturday or Friday. Neja ji was trying to bring some authority from the USA.
Yes, doctor.
So उसके लिए why don't we invite 4 or 5 clubs and other clubs also, so that it can be a inter-club meet along with the Peace and Conflict Resolution Committee.
Definitely, doctor. Definitely doable.
हाँ, तो अभी बड़े क्लब, छोटे क्लब, जो भी क्लब ज्वाइन करना चाहते हैं, तो क्योंकि I'll tell you, an E-Club of Bangalore, E-Club, they have invited so many people from out of India and Indian. I was also part of that. So, and our club is such a big club and a powerful club. We can involve 10 to 15 clubs easily.
Absolutely, doctor. So, Manish, can you just come in, please? Manish, can I request you to please initiate and coordinate with Dr. Patel, sir, also, and see how we can probably.
First of
all,
all,
we can do it. It's doable.
So first of all, let us have confirmation from that American speaker. Once he confirms, then we can go ahead with all this, either this Friday or next Friday, whatever the president feels.
Yes, Dr. Sab. So, Director Club Service will coordinate with Aneja ji and line it up.
So nice. So thank you, Ajay.
But thank you so much. Thank you so much for highlighting this, Dr. Sab. Really appreciate.
And we can involve the DG also for a minute in the beginning. He'll come and say hello and go. He will come. Okay.
Sure.
Okay, sir. Sure. Done. We'll do it. Okay, sir.
Any other suggestions? Shankar Bhaiya, you're on mute. Shankar Bhaiya, you're on mute.
Okay, sorry. So the conference is fast approaching, and maybe we have to start registration for conference.
Yes. Friends, I missed out probably this in the earlier part. It would have been great. Nevertheless, Jushin is a conference where we get a great opportunity to experience world-class speakers who are exceptionally good across. It is very difficult for us to reach out to such people to hear from them. I will be sharing the details of the conference, and I strongly recommend and request all the members to participate. It is one of a kind experience meeting all the people and with different clubs of District 3190, a lot of guests coming from different cities also, and I'll be sharing the details very soon. Shankar Bhaiya, thank you so much for bringing it, and I'm sorry I missed it out in the earlier part of the meeting.
Yeah, Shashi Tharoor, today's information, Shashi Tharoor has agreed to be chief guest. So Shashi Tharoor will be chief guest.
Sure, thank you so much, Bhaiya. Sure. And any other suggestion? Divya, would you like to share your experience and about the Charter Night celebrations where you joined with family? I hope. And let's be very honest about the opinion. You don't have to give any thing. Just talk about honestly about your feedback. Yeah, in fact, we welcome criticism or honest feedback. Please be free.
That's so kind of you, Ajay. Thank you so much. And the first thing is, it was the first time I saw you all, and it was a family, and I was overwhelmed. Even my family was overwhelmed, and they were extremely comfortable. That's a very positive thing. And my kids also enjoyed very much, and my husband also was extremely happy that day. That's the first and the foremost takeaway of this. And I saw there was so much of effort that was being put in to make it a success. So people were so busy, and I think Manish could not sit for literally all the 5 hours that day, and even yourself and Siddharth, everybody walking around so busily, and so many, all the ladies who organized, Dekha, and even I think your spouse, everybody was very busy, very nice.
Thank you, Divya. We are looking forward to your active participation in the club activities as well. And wherever you find more interest, please, we would love to have your active participation and your experience coming in for the activities as well.
I'll be so honored. Thank you. Yes, and some modern day techniques and some modern day sports and other things can be clubbed in. And we will do it all together. So it'll be a lot of fun. Thank you. Thank you, Ajay.
Sure. Thank you. So can we log out now? Are we good to go? Sure. Thank you. Thank you, friends. Thank you. Take care and stay safe, stay healthy. Good night.
Good night, everybody. Good night.
Good night.
Happy weekend.